Hi, ladies. We have something very special for you today. As midwives, we cannot do our jobs unless we have the support of people that are above us. So when you choose us or when you choose one of our obstetricians for your care, there's a lot of work that goes into making that possible. And so I felt like it was very important for you to meet administration today. And for them to give you a little bit of an idea of how they support us and what their thoughts are regarding the care that we're able to provide for you here. CHRISTUS has a wonderful system, a wonderful ministry, and as far as obstetrics and gynecology in East Texas, we're cutting edge, and you can't find anything better. And I'm not talking just about us as midwives, but I'm talking about our whole service, our whole department, including the hospital. So first of all, I want to introduce Mr. Todd Hancock. He's the CEO. He's very supportive of us. This is Teresa Holcomb. She's our Director of Nurses and a very lovely lady if you ever get a chance to talk to her. And this, my friend and my supervising physician and the Chief of OB here at CHRISTUS is Dr. Ricky Paul. And I'm going to let Todd start off and talk to you about his place in overseeing everything and making everything happen for you.
Thank you, Selena. We came here 3.5 years ago, and this organization has a very proud history of support for women's and children's programs. And so it was the highest priority for us to continue with that legacy. And to that end, we've certainly tried to maintain the wonderful services that are here, level 3 NICU, making sure that we provide the best, not only the best care with our providers, which you certainly understand that and got to know Selena and Dr. Paul and others very well, but also making sure they have the best technology and aesthetically making sure the place is beautiful and a place that you want to come and can be proud to deliver your child and to be with your family here. But one of the things that we're very proud of that we've been able to augment or to add to this very important service line that you may not be aware of is that we're one of the only hospitals in this part of East Texas that offers a 24-hour laborist program, which means that anytime, day or night, if there's a problem, there are always OBs that are here on staff that are located physically in the hospital. Think of it as an emergency room for OB. That is a very innovative service. It's one that we fought long and hard to make sure we have. We think it's a game changer in terms of the delivery of care that we want to provide and the quality for a program like this. And so we're going to continue to look for innovation to be able to offer this community. We want this to be the place of choice that all expecting mothers want to come to deliver their child and to recommend that service to others.
Teresa, what would you like to say today as our Director of Nurses?
So good morning to everyone. I'm very proud. I was brought here in October of 17. And as Todd just stated, you know, we're the only women's and children's services that offer an OB/ED in-house program for this area and region. Also was very instrumental in helping bring the midwife program to us to add to our provider program. And as we add components to our program, we're a NICU level 3 designation. And as well, we have high quality clinical providers here. Our nurses and extenders for nurses really have high quality care to provide here. And they do have the technology they need to provide the highest quality of care. And we'll continue to look for new innovations to provide the highest level of care as we continue to support the women's and children's services. I'm very, very proud to be here with this program as it's growing.
Dr. Ricky Paul, as the Chief of OB and the overseer of all midwives, tell us what your role is in making everything happen clinically.
My role is to oversee the safety initiatives, the daily activities, and just to make this whole women's care division work on a clinical aspect. We are building just an elite women's care division here. This is very new, but we have some dedicated providers. It starts in our office, and right now we have 3 physicians, Dr. Weaver, Dr. Dozier, and myself. We have a 4th physician coming in a month, Dr. Michelle Finch, and we're very excited about that. We have 3 midwives, Selena and Dion and Jacqueline Weber, who's out, who just had twin babies that we delivered. It went very well. But our whole goal is to make sure that our patients have the best possible encounters that we can give them. Safety is the main goal. We are on cutting edge, technology. We follow all the best practice, data, and that continually changes, and you have to keep up with that to make sure that what we do for you is the best care that's available. But on the other aspect, we know that this is a very special time. Having your children, that's a memory that you'll always remember. So that's always in the forefront of our mind, and we really try to make it a very special occasion for you. We're a very sensitive team to your wishes, and as long as it's a safe, safety is there, we'll work with you on how you want that experience to be. Our hospital, we have state-of-the-art hospital. Nurses are great. They've been here a long time. We work very well together. We're building team drills, so to speak. We get ready for emergencies that will happen in pregnant women, such as bleeding emergencies or those that have very, very high blood pressure. But we have drills and best practices, so when those do happen, we're ready for them. Todd mentioned the OB hospitalist group. I'm also the site director for that group, and it provides an OB doctor in this hospital 24 hours a day, 7 days a week. The importance of that is when you hit the door and you're having an emergency, you don't have to wait for the nurse to call your doctor and wait 20 minutes for him to get there. There's somebody to take care of you immediately as your doctor's on the way. So that is a very important part of the care for our patients, and we're very proud of that.
Teresa, as a faith-based organization, how do you feel that the mission of Good Shepherd plays into women as they have their children?
Very integral. I think recognizing one's spiritual aspirations is important. And I think that we do individualized care around that because we recognize that there's different cultural differences, preferences. And again, we want to do that by carrying out our mission, by recognizing those individually and then carrying out our care in that way.
So Todd, what would you like to say as a final word that would motivate people to choose Good Shepherd? What is it about Good Shepherd that we provide that you feel like nobody else has?
That's a great question. And as I think about the answer, I would say this, that, I've been in the blessed sacred work of running hospitals for 25 years. I've had a chance to work in a lot of different hospitals, some great hospitals. But this hospital, CHRISTUS Good Shepherd, is truly special. I don't think I've ever worked around caregivers that take their job more serious, that realize the importance and the sanctity of the work. So I think that's a palpable feeling when you come here. I've talked to so many mothers as they're leaving this organization and asked them about their experience. And that's the one thing that really resonates with me is the family and the mother. They really picked up on the fact of how much our doctors and our nurses, our midwives care about them, not just the circumstance of the particular delivery or the particular procedure, but about the person. And maybe that's our faith-based roots. I don't know, but I do know that it's different, and it's different in a good way. And I think if you come here and you experience that, it's certainly something that you will realize and recognize. And I think that's the real takeaway for me.
Dr. Paul, somebody as yourself who gives everything that they have to take care of your patients, how do you feel that plays into the ultimate care for a woman?
Well, it's a very important aspect. The woman comes to see you, they're entrusting their care of themselves in you. So I've always felt obligated to make sure that I gave them that care. We usually take care of our own patients. We don't say, well, I'm going to see you and then somebody else will deliver you. It happens occasionally if we're out of town, but all of the providers that work in our clinic make a very special effort for them to be there for their patients. And I think that means a lot to patients. It's a sacrifice for us, but this is what we signed up for, and that's the way we want to do this.
And don't you feel that your job is not really your job, it's your call?
Absolutely. This is my call. When I come to work, it's not something that I dread because I'm going to be here many hours and sometimes not going for a day or two. It's something that I love to do, and that's why I do it. And I do feel that I was called to do this, and I feel I was called to do it to the best of my ability.
Do any of you have any other things that you'd like to offer to the women that are listening and will be listening in the future for a final word of wisdom?
Hey, I would like to say we would love for you to give us a chance. If you come and allow us to participate in your care, I think that you'll be pleasantly surprised. You are not a number to us in the office nor at the hospital. And we really put effort into making sure that this is a great experience for you.
Okay, we appreciate y'all coming, and if they have any questions for you, if you'd hang around just for a couple of minutes, and then we would like to probably have y'all at a later date too.
Absolutely. Thank you for having me.
Ladies on the line, do we have any questions at this time? Looks like we don't have any questions.
Okay.
Thank you.
Thank you.
Thanks.
Bye.